For many arthritis sufferers, pain is part of the routine. But what if the problem isn't just your joints, but what you're eating every day? You wake up, and the stiffness in your hands feels like a vice. Reaching for the coffee can feels like climbing a mountain. You've tried medications, gentle exercises, maybe hot packs, but that dull ache, that sharp twinge, it just won't let you live comfortably. I understand how that weighs on you, day after day, and how easy it is to feel trapped. You're far from alone. Recent data shows that about 21.3% of U.S. adults, that's millions of people, have been diagnosed with arthritis. For older adults, especially those above 75, the numbers climb even higher. More than half of them live with this condition. And many are limited by pain in their daily routines, sitting, walking, dressing. It's too often dismissed as just aging or something everyone gets. But believing that can keep people stuck, accepting pain as inevitable when it shouldn't be. Here's the hope. Your daily food choices matter. What you put on your plate may be feeding that inflammation or helping to put it out. I'm not promising a miracle cure, but I've witnessed the power of nutrition to calm pain, reduce swelling, and bring back movement. I'm Dr. James Porter. For over 30 years, I've guided patients who thought there was no way forward. And I've seen how small, consistent changes done with compassion and purpose can restore confidence, ease, and freedom. So, if arthritis has been weighing you down and solutions feel out of reach, hang on. You're about to discover gentle, natural ways to support your joints using simple, familiar foods. If this is your first time here, welcome. For kind, practical guidance on feeling better as we age, please consider subscribing gently, on your own time. Let's begin, right here, starting from your kitchen. If there's one spice I wish every arthritis patient would keep in their kitchen, it's turmeric. You've probably seen it before, that bold yellow powder sitting quietly in your spice rack. But turmeric is more than just a flavor enhancer. It's one of the most well-studied natural remedies for inflammation. And when it comes to arthritis, inflammation is the enemy. The power of turmeric comes from a compound inside it called curcumin. This is the part that does the real work, blocking specific molecules in the body that trigger chronic inflammation. One of these is called NF-kappa B, a protein that turns on genes linked to swelling and tissue breakdown in joints. By calming that signal, curcumin helps slow down the very process that causes pain, stiffness, and joint damage. There's more. A clinical trial published in Phytotherapy Research compared curcumin to a common anti-inflammatory drug called diclofenac. The results were impressive. Patients with knee osteoarthritis who took curcumin reported a similar level of pain relief as those who took medication. But unlike the drug group, the turmeric group didn't report stomach issues or elevated liver enzymes. Now, there's a catch here. Curcumin doesn't absorb well on its own. That means if you're eating turmeric without help, most of it just passes through your body. This is where black pepper comes in. Black pepper contains a compound called piperine, which boosts curcumin absorption dramatically by up to 2,000%. It slows down how quickly the liver breaks it down, giving curcumin more time to circulate and do its job. So, if you're thinking of trying turmeric, remember this. Turmeric and black pepper need each other. A patient of mine named June, a 8-year-old former gardener, came to me last year. Her knees had gotten so stiff, she could barely tend to her tomatoes. She wasn't ready for another prescription, so we started simple. One warm drink before bed. Turmeric, black pepper, almond milk, and a bit of honey. Within 3 weeks, she told me she could kneel again just for a minute or two, but without wincing. It wasn't a miracle. It was consistency and understanding how food interacts with the body. If you want to try turmeric at home, you don't need anything fancy. Add it to your soups, stews, roasted vegetables, or rice. Mix a little into your morning smoothie. Or make a cozy drink like golden milk, warm milk, or dairy-free alternative. A teaspoon of turmeric, a pinch of black pepper, and optional cinnamon or honey. And if cooking isn't your thing, turmeric supplements are available. Just be sure the label includes both curcumin extract and piperine. Without that combo, you're not getting the full benefit. Most people start with 500–1,000 milligrams of curcumin per day, but check with your doctor before starting any new supplement. Turmeric isn't about quick fixes, but it's a small, natural tool you can use daily, one that works with your body, not against it. And when it comes to arthritis, every little bit of support counts. Next, we'll explore a group of humble vegetables that do something extraordinary inside your joints, quietly rebuilding them from the inside out. Turmeric and black pepper may help calm the fire, but what about rebuilding what arthritis has already worn down? That's where leafy greens come in. They don't look dramatic. In fact, they're often overlooked, just another part of the salad bowl. But spinach, kale, collard greens, these simple vegetables are packed with nutrients your joints desperately need, especially as we age. Let's start with inflammation, the root of most arthritis pain. Leafy greens contain phytonutrients, including flavonoids and carotenoids, that actively fight inflammatory markers in the body. These compounds help regulate immune function, calm overactive responses, and protect joint tissues from ongoing damage. But what makes greens truly remarkable is their combination of vitamin K, magnesium, and calcium, three nutrients that work together to support not just your joints, but the structures around them. Vitamin K plays a quiet but critical role in managing inflammation. It supports enzymes that keep the immune system in balance and helps prevent the overproduction of pro-inflammatory cytokines, one of the key triggers of rheumatoid arthritis. A study published in the American Journal of Clinical Nutrition found that low vitamin K levels were associated with increased joint space narrowing and cartilage loss in older adults with osteoarthritis. Then there's magnesium. This mineral helps muscles relax and nerves fire properly. When you're low on magnesium, you may feel more stiffness, more cramping, and more fatigue. That's why many arthritis patients notice looser, more flexible movement after increasing their magnesium intake through food. And let's not forget calcium, essential for maintaining strong bones, especially important for those with arthritis who are at higher risk for joint instability and bone thinning. Unlike dairy, leafy greens provide calcium with added anti-inflammatory benefits and without the saturated fats. One patient of mine, Harold, 72, had gradually given up on yard work because of his stiff hips and back. He wasn't interested in supplements, but we worked greens into his daily meals, smoothies in the morning, sautéed spinach at lunch, a kale side dish at dinner. About 6 weeks in, he came back smiling. He wasn't pain-free, but he was planting tomatoes again. That, to him, was progress. Leafy greens are also high in fiber, which supports gut health, and that matters more than you might think. A healthy gut is closely tied to lower systemic inflammation. When your gut is inflamed, your joints often follow. Think of fiber as the bridge between your digestion and your joints. So how can you make leafy greens part of your life without overthinking it? Start small. Toss a handful of spinach into your morning eggs or smoothie. Add kale to your soup or pasta sauce. Make a quick salad with collard greens and drizzle it with olive oil, not just for taste, but because the fat helps your body absorb fat-soluble nutrients like vitamin K. Even one serving a day can start to shift the way your body manages inflammation and joint health. The goal isn't perfection, it's gentle consistency. Arthritis doesn't change overnight. But day by day, the right nutrients can help your joints move a little easier and your body feel a little stronger. And when we come back, we'll talk about one more food rich, flavorful, and surprisingly effective at calming pain from the inside out. So far, we've focused on foods that reduce inflammation and help rebuild what arthritis breaks down. Now, let's talk about a third piece of the puzzle, one that does both at once: fatty fish. Salmon, mackerel, sardines, these aren't just healthy proteins. They're some of the richest natural sources of omega-3 fatty acids, specifically EPA, eicosapentaenoic acid, and DHA, docosahexaenoic acid. These are the forms of omega-3 that have been shown to directly reduce inflammation in joints. Here's how they work. When your body experiences inflammation, especially in conditions like rheumatoid or osteoarthritis, It produces certain signaling molecules like prostaglandins and cytokines. These molecules trigger swelling, pain, and stiffness. Omega-3 second interrupt that process at the source. They reduce the production of pro-inflammatory compounds and increase resolvin's natural agents that help turn inflammation off once it's done its job. In simpler terms, omega-3 second tell your immune system to calm down when the attack on your joints is no longer needed. The evidence is strong. A meta-analysis published in the Journal of Clinical Rheumatology reviewed over a dozen clinical trials and found that omega-3 supplementation significantly reduced joint tenderness and morning stiffness in people with rheumatoid arthritis. Many were able to reduce their reliance on NSAIDs over time. But here's the part most people overlook. Your body can't make EPA or DHA on its own. You have to get them through food, and fatty fish is by far the most effective source. One of my patients, Tom, he's 70, and has dealt with osteoarthritis in both knees, told me he hadn't eaten fish in years. We started small, one grilled salmon fillet twice a week. After a month, he noticed something. Walking upstairs didn't make him wince anymore. It wasn't dramatic, but it was real. That little change gave him back confidence. If you enjoy seafood, try adding salmon, sardines, or mackerel to your meals twice a week. Grill them, bake them, or broil them to preserve the healthy fats. Avoid deep frying, which can cancel out the anti-inflammatory benefits. And sardines? Don't overlook them. They may be small, but they're nutritional giants. They contain omega-3 second, calcium, vitamin D, and they're incredibly easy to keep on hand. Just open a can, squeeze some lemon, maybe add a little olive oil, and you've got a joint-supporting snack ready in minutes. If fish isn't your thing, omega-3 supplements, especially fish oil capsules with at least 500 mg of combined EPA and DHA, are a good backup. Just make sure they're third-party tested for purity, and always consult your doctor before starting, especially if you're taking blood thinners. Omega-3 second don't just reduce inflammation. They improve joint lubrication, support cartilage health, and may even slow the progression of arthritis over time. For many people, they're the missing piece that brings everything else together. So now we've seen 3 natural tools: turmeric, leafy greens, and fatty fish, each playing a different but vital role in helping your joints heal. In the next section, we'll bring it all together into one simple, realistic plan you can actually follow without stress, without perfection, because real healing happens in daily life, one meal at a time. We've covered a lot, from turmeric that calms inflammation, to leafy greens that rebuild from within, to fatty fish that support and protect every moving part of your joints. But now comes the question I get from nearly every patient. Okay, doc, how do I actually do this in real life? It's a fair question, because the truth is, knowing what helps isn't the hard part. It's fitting it into daily life, without stress or confusion. Here's the good news. You don't have to overhaul everything. You just have to build habits that stick, one meal at a time. Start with breakfast. If you enjoy smoothies, try blending one with spinach, a few frozen berries, a banana, and almond milk. Add a pinch of turmeric and black pepper if you'd like. That's your leafy greens, fiber, and anti-inflammatory power all before 9 a.m. If you're more of a warm breakfast person, eggs with sautéed kale or collard greens make a great foundation. Sprinkle in turmeric or serve with a small side of whole grain toast and a smear of avocado. Nothing fancy, just simple fuel for your joints. At lunch or dinner, aim to bring fish into your plate twice a week. Bake salmon with roasted vegetables, a sardine salad with lemon and olive oil, grilled mackerel with a side of brown rice and wilted spinach. These aren't gourmet meals, they're approachable, quick, and deeply nourishing. If you find it hard to cook often, consider prepping one large batch meal with leafy greens, turmeric, and healthy protein, and portion it out for a few days. Think vegetable stew with turmeric and kale, or a fish and spinach rice bowl drizzled with olive oil and lemon. For those evenings when pain tends to flare up, a warm cup of golden milk might become your new habit. A little turmeric, black pepper, warm milk, and honey, can become a nightly ritual not just for joint support, but for comfort and sleep. If cooking is tough or overwhelming right now, supplements can help fill the gaps, but think of them as support, not a shortcut. The real change happens through food, through the daily choices that slowly reshape how your body feels. One patient of mine, Diane, used to think anti-inflammatory eating was too complicated. But once she realized it could be as simple as adding, not restricting, she started enjoying it. She didn't cut out everything overnight. She just added leafy greens to her omelets, salmon to her weekend meals, turmeric to her tea, and she noticed the swelling in her hands didn't wake her up as often. That's the shift I want for you. Not a rigid plan, but a gentle rhythm. Eat more of what helps, a little each day. It adds up. These foods aren't exotic or expensive. They're within reach and more powerful than they look. So don't aim for perfect. Aim for consistent. That's where real relief begins. Next, I want to leave you with a message of hope. Because even if you've been in pain for years, your body still responds to care. It still wants to heal. And it's never too late to begin. Maybe you've been living with joint pain for years. Maybe you've tried medications, physical therapy, or even surgeries, and still, the stiffness lingers. I know how easy it is to feel discouraged, especially when progress feels slow or invisible. But here's what I want you to hear clearly, and with full honesty. Your body is always listening, and it still wants to heal. Healing at this stage of life may not mean being pain-free, but it can mean waking up with less swelling, moving more freely, regaining moments you thought were gone, like walking the dog without hesitation, or climbing stairs without bracing yourself first. And that kind of healing doesn't come from shortcuts. It comes from showing your body that you're on its side. The foods we've talked about, turmeric, leafy greens, fatty fish, aren't magic bullets, but they are quiet, powerful allies, working gently in the background. They calm inflammation. They nourish tissue. They support the systems that keep you moving, thinking, and living with dignity. And the beauty is, you can start today. You don't need to wait for a doctor's appointment or a prescription refill. You just need a small decision. Maybe it's what you put on your plate tonight, or how you flavor your tea tomorrow. One choice turns into a habit. One habit turns into a shift. And little by little, you move toward feeling better. Not perfectly, but better. I've watched so many of my patients go from stuck and frustrated to surprised and hopeful, not because they did anything extreme, but because they stayed consistent, stayed curious, and gave their bodies a chance to respond. That same path is open to you. If you've made it this far in the video, thank you. Truly. It means you're not giving up on yourself. And that matters more than anything I could say. I hope you walk away from this not just with information, but with encouragement. With a sense that you can take back some control, even if it's just one meal at a time. If this video helped you in any way, or if you want more content like this, gentle, honest, and practical, please consider subscribing to Golden Health. This channel is here to support you, to walk with you, to remind you that aging doesn't mean giving up, it means adjusting wisely. And if you know someone else who's quietly battling arthritis, feel free to share this with them. You never know who might need to hear that healing is still possible. Until next time, keep going. Keep nourishing your body, and most of all, keep believing that a better tomorrow is still within reach.